Hello students, let's study Vibrio cholerae. So Vibrio cholerae classification based on Gardner and Venkatraman. So Vibrio, they are divided into two groups, Vibrio cholerae and other Vibrio species. Then subgroups of Vibrio cholerae 01, 0139 and non-01, 0139. So that means they are 02 to more than 200. Then biotypes 01 is divided into classical and Eltor, and serotypes classical Eltor are divided into Ogawa, Inaba, and Kojima. 01 subgroup agglutinated by O1 antisera, responsible for all pandemics and most of the epidemics of cholera. Non-agglutinable vibrios not agglutinated by O1 antiserum, initially thought to be non-pathogenic, non-cholera vibrio. O139 serogroup, O139 not agglutinable by any of the antisera available at that time, 01 to 0138. So it is called 0139 Bengal strain, spread rapidly along the coastal region of the Bay of Bengal. Non-01, 0139 subgroups, serogroups have occasional sporadic outbreaks of diarrhea and extraintestinal manifestations, but never epidemic cholera. So Vibrio cholera. Morphology curved gram-negative bacilli, actively motile by single polar flagellum, non-sporing, non-capsulated. Pathogenicity cholera, transmission, ingestion of contaminated water and food. Virulence factors cholera toxin, fragment A1, active fragment adenyl cyclase converts CAMP, increase in CAMP, accumulation of sodium chloride in intestinal lumen, water moves passively into bowel lumen and watery diarrhea. Loss of fluid and electrolytes, shock due to profound dehydration and acidosis due to loss of bicarbonate. Clinical manifestation, watery diarrhea, sudden onset of painless watery diarrhea, rice water stool, watery with mucus flakes and inoffensive odor. Vomiting may be present, but fever usually absent. So according to weight loss, less than 5%, increased thirst, symptoms, increased thirst at 5 to 10%, postural hypotension, weakness, tachycardia, decreased skin turgor. More than 10% water loss, symptoms, renal failure due to acute tubular necrosis and fluid loss result in oliguria, weak or absent pulses, sunken eyes, sunken fontanelles in infants, wrinkled skin, washer woman-like appearance, somnolence, and coma. Lab diagnosis specimens, freshly collected watery stool, rectal swab, convalescent and carriers. Transport or holding media, Venkatraman Ramakrishna medium, alkaline salt transport medium, Caribbean medium, autoclaved seawater. So all these have their alkaline pH. Gram staining of mucus flakes of feces, short covered comma-shaped gram-negative rods arranged in parallel rows called as fishing string appearance. Motility testing, hanging drop, darting motility, shooting star swarming, gnats motility. Culture, peptone water, uniform turbidity with surface pellicle, aerobic. Nutrient agar, translucent colonies, blood agar, hemodigestion. Enrichment media, alkaline peptone water, Mansour's taurocolate, telluride peptone water. Selective media, alkaline bile salt agar, Mansour's gelatin, taurocolate, trypticase, telluride agar, pH 8.5, translucent colonies with grayish black center. McConkey agar, late lactose fermenting colonies. TCBS agar, thiosulfate citrate bile salt as inhibitor. Sucrose, pH 8.6, yellow color colonies because of the sucrose fermentation. Identification, biochemical testing, biotyping. Catalase oxidase positive, indole positive, VP positive for Eltor and negative for classical. Citrate variable, urease negative, TSI, acid by acid gas absent, H2S absent. Nitric reduction is positive, cholera red reaction positive. String test, colony mix with loop of 0.5% sodium deoxycholate on a slide, string is formed. Salt tolerance test to differentiate from halophilic vibrio. Serogrouping by agglutination with Vibrio cholerae polyvalent O antisera. First, the colony is tested with O1 antisera. If found negative, then tested with O39 antisera. And then serotyping. So, 01 Vibrio cholerae can be of two types, classical and L2, and they are differentiated on basis of these investigations. So beta hemolysis on sheep blood agar, classical negative, L2 positive. Cheek embryo, cheek erythrocyte agglutination, VP, is then CAMP, negative for classical, positive for L2. Polymyxin B, 15 international units, classical sensitive, L2 resistant. For Phage susceptibility, classical susceptible, L2 resistant. L2 Phage 5 susceptible, classical resistant, L2 susceptible. Cholera toxin CTX1 classical and L2 CTX2. Then serotypes Ogawa Sera antisera and Inaba antisera. So Ogawa antisera plus Inaba minus Inaba Ogawa minus Inaba antisera plus Hikojima Ogawa and Inaba antisera both plus. Treatment of cholera, fluid replacement, most important, mild to moderate fluid loss, oral rehydration, ORS solution, severe cases, intravenous fluid replacement with reverse lactate or normal saline. Antibiotics have a minor role as pathogen is toxin mediated. Drug of choice, macrolides, erythromycin, azithromycin, alternative doxy, ketra, ciprofloxacin. Prevention general measures, safe water, sanitary disposal of feces, proper food sanitation, prompt outbreak investigation and steps to reduce transmission, notification, health education, chemoprophylaxis, tetracycline, household contacts only during epidemics. Hello students, let's study Pseudomonas. In morphology, gram-negative bacilli, actively motile bipolar flagellum, Pseudomonas aeruginosa, green pigment, pyocyanin, bluish green, fluorescent greenish yellow, other pigments, pyoverdine, pyorubin, and pyomelanin. Classification, pyocene pigment present, Pseudomonas aeruginosa, pyocene pigment absent, Pseudomonas malai, Pseudomonas sulomalae. Pathogenicity, virulence factors, pigment production, inhibit other bacteria, diffusible toxins, exotoxin A, proteases, phospholipases, hemolysin, elastase, pyocyanin, mediate tissue injury. Exotoxin A, most important virulence factor for Pseudomonas aeruginosa. Clinical manifestation, nosocomial infection, suppurative otitis, infection of wound, eye, burn, urinary tract infection, diarrhea, meningitis, septicemia, ventilator-associated pneumonia, chronic respiratory tract infection, bacteremia leading to sepsis, septic shock, infective endocarditis, ear infection, eye infection, skin soft tissue infection. Laboratory diagnosis, specimen, pulse, wound swab, urine sputum, blood, CSF, direct smear, gram-negative bacilli, culture, obligate aerobe, nutrient agar, large irregular colonies with metallic sheen with pigment production. Characteristics with odor, alcohol-like fruity odor. Then blood agar, beta hemolytic gray colonies. Meconchi agar, pale non-lactose fermenting colonies. Selective media, cetrimide agar. Then biochemical reactions, catalase positive, oxidase positive, indol MR urease negative, citrate positive, TSI K by K, and then AST is done for drug sensitivity testing.
Hope you find this session useful for your understanding and for your exams. Thank you.